Hey guys, it's Dr. Diaz again with Momentum Chiropractic and Rehab. We're actually videoing this little segment today just to talk about, we've had some questions about self-manipulation or self-adjusting. We've had a couple of YouTube viewers say, hey, you know, what can we do? Can you give us some tips on self-adjusting? Should we self-adjust? So on and so forth. So what we're going to do today is we're going to use our spinal model just to show you our opinion and why we have the opinion on why we believe that you should not self-adjust or self-manipulate. So we're going to have you focus right in here. So here's a spinal model. Right here we have the base of the occiput. We're going to have the spinal segments. So we have the cervical segments right in here, thoracic segments right in here, translating into the lumbar segments right in here, your sacrum, coccyx, so on and so forth. So self-adjusting here. What's going to happen is when you come into a chiropractic adjustment, we're going to find a calculated restricted motion. So as we're palpating, we're finding which one is not following the 6 ranges of motion: rotation, flexion, extension, lateral flexion. When we find that restricted segment, we're going to use a calculated line of drive. So our hands are going into the level of restriction. So we're using a calculated line of drive to create motion and to restore motion into the segment. With segment restoration or motion restoration, we have appropriate nerve communication. Right inside here, we're going to have lymphatic channels, so we're going to have veins and arteries that are going to bring blood supply. We stimulate the body to have the proper lymphatic drainage in the area. When you self-adjust, you're self-adjusting through the same segment over and over 10 to 15 to 20 times a day. What that may cause, self-adjusting may cause ligament laxity, joint laxity, joint instability. What's going to happen when the joint becomes unstable, the body is going to try to stabilize the joint, causing an arthritic change. It's going to try to develop a bone spur, something to try to keep it from moving so much, right? Once you have that arthritic change, you're now going to increase segmental inflammation, cake the nerve roots with inflammation, cause radiation down the arm, cause more issues than you're originally having from just muscle and joint discomfort. So my professional opinion, I'd say do not self-adjust. Find a licensed professional chiropractor to find your areas of restriction and perform a proper chiropractic manipulation in the proper line of drive. Thank you and have a great day.